A pleasant day and a warm welcome to your favorite show, iMed, the medical program that we discuss many issues, giving you advices to lead a successful life and prevent you getting in trouble with regard to disease conditions. Today, we are going to focus on a specific topic, which is endometriosis, a disease condition with regard to most of the people. That means leading a successful life with having children and leading a successful, healthy family life is our prime concern. So, in order to advise you in this discipline, we invited Dr. Sudat Senaratna, consultant in subfertility and IVF. Thank you very much, sir, for joining with us and accepting our kind invitation. And sir, to start off today's topic and without any further explanations, can you just explain us what endometriosis is?
So, endometriosis is one. If you ask me what are the most unpleasant disease or condition that you want to have, I would say it's endometriosis. So diseasing. So we don't know why that happens. So the incidence is about 10% of females will have endometriosis. Simply, if you outline what is endometriosis, your womb have an inner layer called endometrium, which is shed out through the vagina monthly, if you are not getting pregnant. The endometriosis is when there's a retrograde flow and it goes back to your tummy, and some people have get them implanted, and monthly they grow, and unfortunately this blood that goes back causes inflammation, which causes a process. So when you have wound, you have inflammation. When you have fever, a germ goes into your body, you have inflammation. Like that, the blood causes inflammation in your tummy, in your pelvis, and it causes symptoms. That's basically what you call endometriosis.
Is it's like the most unpleasant disease that means if that is being caught with a certain female, that means everything is lost, or can this be treated? We'll be discussing about the treatment as the outline.
You know, it's like control. So it's like the symptoms we have, we try to control, and sometimes we have to get rid of the whole thing, but we can control it, but it will be a lifelong treatment.
Right. Okay.
Every time you get a period, you get symptoms.
Right. So what are the types of endometriosis?
So types, basically it's depend on the severity. You call it type 1 to 4. 1 is where you have some visible lesions, a little bit of a patchy spots here and there, and number 4 would be completely your pelvis is frozen. That means that your tissues will be stuck together, tubes, ovaries, your rectum, your bladder, and your vagina, everything is stuck together as one whole mass, and you have severe pain. So those are the categories. In between, for management purposes, we divide into 4 categories.
So explaining a bit more with the 4 types, is it like the type 1 the most commonest, type 4 the most commonest, or any comment on that, sir?
Yeah, again, it's goes with age, right? We see type 1 in younger females and type 4 in elderly. We see a lot of endometriosis in most of the elderly people, over 35. So that's why you want to say that you have to finish your family before 35. It's basically goes with the age. We see a lot of endometriosis in elderly in sense after 40. But occasionally we come across patients with endometriosis in younger people, 25 to 35, especially when we investigate for infertility. It's one of the main causes of infertility in female.
Right. So when regard into the signs and symptoms of endometriosis, how can you comment on that?
Yeah, again, the symptomatology does not depend on the severity. For example, you might have type 4 endometriosis, no symptoms at all.
Right. Is it silent for a particular period? Oh,
yeah, patient might not complain.
Right.
Then might have symptoms, but it's tolerable. Whereas even with the simplest type 1 or grade 1 endometriosis, they might have severe symptoms of pain. The main symptoms come with the periods. So when you have period, your blood flow goes back to your tummy and cause inflammation. So we'll have symptoms, especially during your time of your period. Sometimes you can have latter half of your cycle having this pain. Right? Sometimes, usually it comes with periods and peaks with the period, and basically over last few days after periods.
That means in any month, like if we are getting periods, that means the symptoms or the pain or whatever the causes, it arises mildly and go to a peak level and then drops gradually once after a couple of days.
Yeah, exactly.
Happens regularly.
It's happened every cycle.
Every cycle.
Yes.
Right. Okay, so when it comes to the causes of endometriosis, what causes this disease?
Unfortunately, we have not find a definitive cause. The pathology is that you have basically we call retrograde menstruation, the blood goes back, and some families have them. Your mother or sister have, there are high chance that you can also have.
That means a genetic predisposition.
Yes, and we have found out certain chemicals that might stimulate the endometrium tissue outside your womb. And again, come back to your lifestyle also. People who exercise or maintain good lifestyle have lesser chance of having endometriosis.
Right. So when coming to possible causes, actually it is not particularly defined, but when it comes to proper management of lifestyle and even be not exposing to certain other harmful chemicals, and some other times the endometrium or the place where this pregnancy and the whole scenario happens, simply the womb, it's not precisely the womb, but think that it's that particular area. So you have to maintain the proper hygiene thereon, and even in some complications which will affect the inner tissues, muscles or structures, simply you will be getting this type of disease. And so like this disease, you mentioned that there are many possible scenarios going through and out of this thing. And when it comes to complications of this disease, how can you comment on that?
Again, we have to look at in this way, like it causes severe mental issues. Like for example, we have experienced not to not to insult anyone, we have some teachers who's getting very angry easily in our childhood.
Yes.
So that's one symptom. Your emotional state is not stable. When you have periods, you get this pain every time and you can't control yourself. You get angry very easily. Sometimes you get depressed even.
Right.
And you feel bloated. You don't feel your hunger and do not eat, and it disturbs your sleep, and it disturbs your urination, bowel habits. So basically you are basically out of this world during this period. That's the main concern of this problem. So it's mainly it affects you socially, and you might avoid sexual intercourse, you might avoid your husband or anyone or social connection. You withdraw from the society or the social connections during this period because there's so much stress. The one main factor of this endometriosis.
Right. So when coming to those factors and discussing those factors in detail, stress management should be considered, and certain other related consequences, the pain, and with those things, as you said, a beautiful example also, we should understand that mechanisms, and we should, like, those are the particular complications. And so like there are many diseases. For an example, as we discussed, person with diabetes, a non-communicable disease, can be prone to infertility or subfertility, or even if there are thyroid issues, as our previous program, there may be certain complications with regard to the similar thing. With this endometriosis, can a person be infected with something like any other heart problem? I'm not exactly saying that it's a heart problem. This endometriosis, a person suffering from endometriosis, what are the possible diseases that she can caught up? Because endometriosis is prone to females, so what particularly? Especially
if you have to think of any condition that endometriosis will lead to, is the infertility and the pain, cyclical pain and the infertility, the main issues. Well, recently there are some papers which said that it led to cancer, but it's not proven yet.
Right.
But it's a possibility, because we have the ovary, the pelvis doesn't have this endometrium, but when you have endometrium inside your womb, there's one place that you can have cancer. So when you have that tissue outside your womb, so still you can have cancer there. So there's no direct link, but they are going to explore it. But basically the main concern with endometriosis is the infertility and this cyclical pain management.
Right. And so like when it comes to certain diseases, if someone is watching the program, if they are getting a severe pain, because the patients with normally endometriosis complain, or rather they mess up with the abdominal distension, abdominal pain, and you also explain this severe pain likewise. So if someone is watching this program, they might think I have severe abdominal pain, and with the psychological impact they will think that yes, it's particularly occurring within the time period that I'm having periods. Yes, it peaks up. Yes, it ends up within a couple of days after this period. Is it the only thing that gives rise to that type of a pain?
No, the pain during period can be due to many causes, mainly endometriosis and the pelvic inflammatory disease, where you have infection in the pelvis.
Right.
It's basically overlapped symptoms, but it's basically when you have symptoms associated with your periods, it's better to do some test, maybe do an ultrasound scan and see whether you have any of those conditions, because basically we can manage this pain well, and depending on your requirement. For example, if you just want to manage your pain, we can do that, and if you want to become fertile, then we have a different way of managing. So basically you should not suffer. You should understand that this can be controlled in different way for different age groups.
Right. So sir, when a person, female, is suffering from endometriosis, with that stress, with that severe pain, she might avoid the society, she might avoid the close relatives, and particularly she might avoid husband and avoid sexual intercourse, and there will be certain basic issues. Keeping all those things, if the person is quite strong enough, she will continue her successful life in an ordinary manner.
Yeah.
Is there any possibility for that person to become pregnant? Any fertility issues?
Yes, as I said earlier, this is symptoms associated with not associated with stages. A lot of people, out of females with endometriosis, they are quite symptomless. For example, when we investigate fertility, when we fail the first steps of management, we do see why she is not getting pregnant. Then we do a laparoscopy, then we find endometriosis there.
Right.
So maybe in a scan we will find a small deposit of endometriosis. So on the other hand, patient will have endometriosis with symptoms or without symptoms. So basically the patient come to us with the symptoms. So when patient having symptoms or the infertility, one of the main symptoms is not the symptoms. When patients are not fertile, we look for endometriosis there. On the other hand, patient when come with the symptoms, we look whether she has endometriosis. So just your summarize your answer to a question is yes, they can get pregnant. There are ways of means of getting pregnant even you have endometriosis.
Right. So will that affect a successful childbirth?
Yes, they can.
Right. So might be complications, but we can still expect some good thing.
It's not easy.
Right.
It's not easy. But
there's a possibility.
There are a lot of people who have with endometriosis who can conceived.
Right. Okay. So with that, sir, like what I felt and what most of the viewers might be feeling is that if someone is having endometriosis, as you said, and with our discussion, they might think that most of the people or some, they might not feel the symptoms. They might not know that they are suffering. If we don't have any particular symptoms, although if we have, people are reluctant to visit physicians. Might be the expenditure, might be the hassle that they are undergoing, might be like they are not like to drink medicine. So with that, normally, purposely also, if they are having something, they try to stay quiet and calm, and if the disease is going to a normal condition, they are quite okay. And without a disease, a person won't go anyways. Without a disease, investigation is that when going through a different mechanism, we find that this person is suffering from this, otherwise they won't catch this up. So there is a greater possibility to left this disease untreated. What are the consequences?
If you this is the disease that you need to treat only patient has symptoms. So most of them come with the pain, and a few come with the issue of subfertility. But on the contrary, when you initiate, for example, out of the population, 10% will have symptoms, come with the symptoms of this menstrual cycle symptoms, and found to have endometriosis. On the contrary, if you initiate subfertile couples, but 40% of females will have endometriosis. So that's incidental finding. So when you look into them why they are not getting pregnant, you find that they are having a minimal or maybe severe endometriosis. So that's basically a scenario. If you left untreated, it will grow. I mean, they, for example, they can go on to from stage 1 to stage 4 within maybe about 5 to 6 years, 10 years, and then we'll have like in severe situation like bowel obstruction, and severe loss of weight or something like it have an impact on their life, or again the sexual dysfunction. Then they come to us and we do surgery, and then we can treat them well.
Treat them, right. Okay, so with proper treatment and proper diagnosis, it can be curbed and managed. And if you are having some sort of a mild pain or something like that, that might be just a muscle pain or something, but there might be symptoms for a certain disease like this. So we don't know, because anyone can't predict ourselves, but the best way is that we have experts with us, doctors who have a thorough knowledge on this. They have this expertise, so visit a doctor, consult them. If you don't have any problem, it's quite okay, no need to drink medicine. We have investigations, diagnosis mechanisms, and more to investigate and diagnose these things. And so when discussing all those issues with regard to fertility, infertility, subfertility and those things, people like neglect that thing from the society, and if someone is suffering from that particular disease, people try to let him or her down. And when it comes to endometriosis and certain other those types of conditions, STDs also, that means sexually transmitted diseases, also coming to a prominent place. Is endometriosis sexually transmitted?
It is not.
It's not.
It's not. It's not a sexually transmitted disease. So the thing is, the symptoms of endometriosis and sexually transmitted diseases overlaps. So when patient comes with the symptoms like menstrual pain, the feeling bloated up, and like depressed and heavy flu, we even in the milder case of endometriosis, we find it difficult to find unless you have a large cyst or a lot of adhesions. So it's not a sexual transmitted disease, but there's an overlap.
Right. So endometriosis is not sexually transmitted, and so can sexually transmitted diseases cause endometriosis?
No,
it's not.
It's the pathophysiology or genesis is quite different.
Quite different.
As I said, it's basically due to retrograde flow and genetic predisposition, and maybe congenital, and as I said earlier, external environment factors like toxins and your lifestyle may be the reason. It's not, I mean, even who are not sexually active will have endometriosis.
Right. Okay. So with that thorough explanation, I think very much clear. Sexually transmitted diseases, endometriosis, are two different. They are with that nature, the function medically, it's pathophysiology or something like that, they are different, but the symptoms might be similar. Being similar with symptoms is not that similar causative factor, similar disease, types of a similar origin. So it is nothing to neglect, nothing to regret about those things. So those are two different types that we concern. And so we discussed about certain tests. We can do blood tests, any ultrasound scan or something like that. So when moving to a doctor, what are the other possible types of investigations?
Yeah, usually it's not very common, but we find incidentally we find endometriosis. For example, if I have a slide, I can put the first slide. This the patient came with totally different symptoms. She had upper abdominal symptoms, right? So when I did a scan on her, this is what I found. There was a lot of cyst, and this picture, if you do difficult to interpret, so there's a huge cyst there. I got it from the ultrasound scan, and we found endometriosis. So the symptomatology is quite different from the exact clinical diagnosis, and she had surgery. This is one other cyst. This also asymptomatic, and she came for some other problem, and we found out to have endometriosis. So it's it's kind of a medical mystery. So I'm not saying that everyone should have ultrasound scan.
Yes.
But we come across endometriosis very common with a lot of other symptoms. Basically, when you come to the physician or surgeon, they are referring to us for a gynecologist. When we do ultrasound scan, they found accidental endometrial cyst. So other than the ultrasound scan, for example, for a good experienced gynecologist, even from the history, they can diagnose endometriosis. And when you do the examination, vaginal examination, you can confirm the diagnosis. There are certain way, like I'm saying about the stage 3 and stage 4 endometriosis. And if you do ultrasound scan, definitely you can diagnose. It's not confirmatory, but you can see the typical picture of a endometrial cyst, cyst containing blood cells. The final diagnosis, the confirmatory diagnosis would be a laparoscope and taking a biopsy. So we don't do it for everyone because, as I said, this doesn't cause cancer. So you can keep your endometrial as it is and manage your distress. And in certain condition, like if you found out have some kind of sort of a large cyst and you think of adhesions and causing bowel and bladder irritation, then we might offer you laparoscopy, and that time you do biopsy and take a sample and confirm. And since you asked it, another blood test that we do on called CA125, which is mainly to see that you have a cancer. But in non-cancerous patient or endometriosis, this levels goes a bit high. So, for example, if somebody write that test and you get a report that is high, and you search, and intend to ask your friend who is a doctor, I have blood test which is CA125 a bit high, and it says it goes up in your when you have ovarian cancer, so people get scared. But it's not. I mean, everyone who has high CA125 will not have a cancer. But in endometriosis, we commonly come across patient in the endometriosis we have a little bit of high CA125. It's not a diagnosis test, but it helps in diagnosis.
Right. So those are some investigations that doctors, physicians perform when it comes to endometriosis and certain consequences. And so, like the pictures that you displayed, some of your patients that you perform surgery. Let's move on to that surgical aspect. So performing surgery, will it like the success of the surgeries and the other related scenarios?
It depends on symptoms. For example, patient having severe pain, and if he had completed a family and doesn't have fertility wishes, we don't offer surgery unless he has a big cyst. So with a big cyst which press on the bladder or the rectum, or having symptoms of bowel and bladder, we do remove the cyst. And again, if you have difficulty in having sexual intercourse and with pain with sexual intercourse, we do surgery to remove this endometriosis. Otherwise, we can control symptomatology. Like as I said, it's come with the bleeding. So we can reduce the bleeding, the symptom will be less. If you stop bleeding, there will be no symptoms. So depending on the patient request, we offer surgery or medical management. Surgically, very essential part in management is subfertility. If the patient is subfertile, it affects your fertility. It affects your ovulation, the quality of egg, the survival of embryo, and it might destroy your semen. So removal of endometriosis is a very important aspect of treatment of subfertility. Then for a patient with subfertility, we go for surgery very early. Otherwise, we don't have to operate on each and everyone who's having endometriosis.
Right. So those are the related scenarios with regard to the surgical aspect. It might not be surgically intervened. You can have medical management with drugs and certain things. It depends on the signs and symptoms that you have. And if it is essential, vital, they will perform the particular investigations and move to a surgery. And so, like, can you just, as the latter part of the program, can you just explain? We explained in our session discussions and with the discussions certain points to prevent that thing, how to manage. So as the final minutes, how can you advise the general public how to prevent this disease, or rather a management of lifestyle?
Yeah, at the beginning of the discussion, I said that it's becoming common in younger females. So if your daughter, or if you are at a younger age, if you have symptoms associated with your periods, it's better to have a look and see a doctor and just consult to see where you are. For example, if you have milder disease, we might not intervene, we might not do surgery, we might not even in medicine. But how, if you want to prevent, I mean, having endometriosis, someone you love, or you know that you want her to not to get endometriosis, what you need to do is ask whether a cyst or mother or aunt having endometriosis, then you are at high risk group. And then what you can do is, we have found out doing regular exercise and having good body weight will reduce the incidence of endometriosis. And then again, there is recently paper, they said that there are chemical dioxin which forms by charring, like if you take barbecue or like burn food or even burning of plastics, which remain in your water and deposit in the water, and it's recycled. So the occurrence of the dioxin and toxic chemicals can cause infertility. So we have to be very careful with the food. Right. Have a healthy food, have a healthy lifestyle, do some exercise, maintain good body weight, and bring back to our previous discussion, try to marry early and conceive early, so we will not have any detrimental effects of endometriosis.
Right. Yes, and with that idea and explanation, so we discussed about the preventive aspect and the management, and as the final moment, like with our guest Dr. Sudat Senaratna, we emphasized the preventive aspect and the importance of managing this disease is to enlighten the general public once again, and the latter part of the program is to give you the particular thorough understanding of the disease, how you can prevent, how you can manage, and how you can lead a successful life. So thank you very much, sir, Dr. Sudat Senaratna, and consultant in subfertility and IVF, for joining with us with today's program. We discussed about endometriosis and the consequences. Thank you very much, sir.
Thank you.
And stay tuned with IMED for many other episodes in the future as well. We'll be discussing many important areas in the discipline of numerous topics which will help you to improve your health standards. Thank you very much for watching. Have a pleasant day.